proctology examination is examination of the rectum and the anus. The reasons are usually that patients complain of bleeding from the rectum. They might have change of bowel habits. They might have discharge, pain in the anus, either when they're passing motion or just not passing motion. It may be that they have piles or they can feel a lump. So there's a variety of reasons, and we would look and inspect to see what the causes are, and then we can on the basis of that examination formulate a treatment pathway and what would help patient with those symptoms. We would explain what a proctology examination would be at the beginning, because everyone's quite concerned, and it's a sort of intimate examination and they feel uncomfortable. So you'd say what you're going to be doing, but patients lie on the left side. You will inspect the area first. You want to look, is there any cuts? Is there any fissure, which are actually painful cuts? Is there any external piles or skin tags? Sometimes they can be quite mistaken between the two. Are there any scars from any previous operations? So you would just look and inspect and take all that down, and we would then proceed with a rectal examination with a gloved finger. And if it's painful, we would stop. But the aim of a finger examination would be to feel if there's any mass, are there any polyps, are there anything uneven that we could feel. We would then proceed with proctoscopy and or rigid sigmoidoscopy. Proctoscopy is a small plastic tube that goes into the anal canal, and it is just to look at the anus, and it's usually for things like assessment of the grades of the piles, because depending on the grade of the pile, you have different treatment options. So we can see what grade they are, what options of treatment there are available. But also, again, you can have polyps exactly in the anal canal, or you can have fissures and so on. We might look for fistulas, which can also be a problem. The next step, which sometimes is required, but sometimes we wouldn't proceed to, is called a rigid sigmoidoscopy. And that's when you put a longer tube in the rectum, and it is to look at further up in the rectum. So you would blow a bit of air to open up the rectum and have a look inside. And that's quite useful, again, for what I've mentioned already. But sometimes you have inflammation of the lining of the bowel. It's called proctitis, and that's quite helpful for that sort of diagnosis. Patients don't need to do anything. You don't need any particular preparation. It is more to be aware of what's going to be happening and understand the steps, really. So as far as what needs to be done at home before coming, and nothing needs to be really done. Proctology examination is generally quite quick. I'd say it'd be about 5 minutes the most. If it's, as I say, if it's painful, we would not proceed because very often one is you don't want the patient to be in pain, and two, you don't get much information when they are in pain because inevitably there's going to be clenching. So we wouldn't proceed with that. So I would say about 5 minutes.